So we're moving to the next syndrome we should be discussing. And for the next syndrome we should be discussing is what is known as a Hunter syndrome. Hunter syndrome. Okay. Hunter syndrome. So Hunter syndrome, just so you know, is a mucopolysaccharidosis type 2. That's another name for it. So it's a rare, it's an inherited lysosomal storage disorder, and primarily it affects boys. Okay. So it belongs to a group of mucopolysaccharidosis, and is caused by the body's inability to be able to break down some certain complex sugars, the glycosaminoglycans. So if they have not been able to break down, if the body is not able to break down these sugars, they accumulate. Do you understand? So the enzyme that is missing is an enzyme known as the iduronate 2 sulfatase. So it's an X-linked recessive issue. So females are carriers, males will now be affected. So there's an inability to break down the dermatan sulfate and the heparan sulfate. Okay, so they now accumulate in tissues and they will lead to multi-system disease. So clinical features usually comes up between age 2 to 4. Physical signs is a coarse facial features, enlarged liver and spleen, joint stiffness, short stature, there's thick skin, the rest of it. So on the neurological issues, you have developmental issues, behavioral problems, progressive intellectual disabilities. So other complications could lead to hearing loss, could lead to heart valve disease, lead to airway obstructions, lead to sleep apnea. Okay. So diagnosis is urine test. So you see that the glycosaminoglycans, that's dermatan sulfate, heparan sulfate, their levels will be so high. Then you also try to access the activity of this enzyme, and you see that the iduronate 2 sulfatase, the enzyme is reduced. Okay. So genetic testings, okay, you also confirm that the gene is mutated. Then imaging, this is where you're now trying to image to see if there's any skeletal abnormalities. So you treat it by replacing the enzyme that is missing. So the enzyme that is missing, you replace it. Then you now start managing it symptomatically. So heart issues, you check them. Respiratory issues, you check them. Hearing issues, you check them. Skeletal system issues, you also check them.